What is Paget's disease of the bone? Have you ever wondered what happens when your bones start to behave differently? Paget's disease of the bone is a chronic condition that causes an abnormal and accelerated process of bone remodeling. In simple terms, this means that the bone tissue breaks down and rebuilds faster than it should. This disruption leads to bones that are enlarged, weakened, and sometimes even deformed. Unlike healthy bone remodeling, which is slow and controlled, Paget's disease results in rapid and disorganized bone formation. This produces bones that are structurally weaker and more prone to deformities and fractures. Paget's disease most often affects people over the age of 50 and is more common in individuals of European descent, particularly men. It can impact one or several bones, with the pelvis, spine, skull, hips, thighs, and legs being the most frequently affected areas. Symptoms of Paget's disease can vary widely. Many people may not experience any symptoms at all, and the condition is often discovered incidentally during imaging for other reasons. When symptoms do arise, bone or joint pain is the most common complaint. This pain is usually dull, deep, and persistent, sometimes worsening at night. The affected bone may feel warm due to increased blood flow. Other symptoms can include bone deformities, such as bowed legs or an enlarged skull, headaches, hearing loss if the skull is involved, and nerve-related issues like tingling, numbness, or weakness due to nerve compression near the abnormal bone growth. Complications can arise from Paget's disease, including fractures due to weakened bones, osteoarthritis in nearby joints from altered bone structure, and nerve compression symptoms, such as sciatica or loss of limb function in severe cases. Diagnosis typically involves a combination of clinical evaluation, blood tests that may show elevated markers of bone turnover, and imaging studies like X-rays or bone scans that reveal characteristic changes in bone structure. Treatment aims to control the abnormal bone remodeling process and relieving symptoms. Medications called bisphosphonates, which are also used in osteoporosis, are the mainstay of therapy. These medications help slow down bone turnover and strengthen the bone. In some cases, surgery may be necessary to correct deformities or fractures. From the perspective of osteoporosis, Paget's disease shares the feature of weakened bones but differs in its underlying mechanism. Osteoporosis primarily involves a reduction in bone density due to increased bone resorption and decreased formation, leading to fragile bones. In contrast, Paget's disease involves excessive but disorganized bone formation, resulting in structurally abnormal bone. Both conditions increase fracture risk but requiring different management approaches. In summary, Paget's disease of the bone is a disorder of abnormal bone remodeling that causes enlarged, weakened bones. This can lead to pain, deformity, and complications, particularly in older adults. While it is distinct from osteoporosis, both conditions share the common theme of compromised bone strength. Treatment with bisphosphonates can effectively control the disease and reduce symptoms. Always consult healthcare professionals for personalized advice and treatment options.